So my name is David Heaton. I'm the Public Information Officer for the Southwest Utah Public Health Department. Just to give you a little brief introduction to us, we are a 5-county health department. So we cover Washington, Iron, Kane, Beaver, and Garfield. And I think currently that's estimated to be about 230,000 residents of the area. We go all the way from the huge metropolitan area of St. George to some of the most frontier places out in Bullfrog or Tickaboo in Garfield County. And so the way that we get information out to people is quite varied. A lot of it is online. We publish a magazine that we send out 3 times a year to most of our residents. We go through the traditional media. We go with our website. One of my favorite ways of getting information out to people is speaking face-to-face like this. And because of technology, there's some of you that are also connected in some outlying offices. Our director is Dr. David Blodgett. He is the only MD health officer we have in the state of Utah. So there are 13 local public health departments in Utah, and we are one that gets to have an MD doctor as our director. He's Johns Hopkins educated, has his MD and also a master's in public health, and is actually an expert and has background in pandemic response. Since 2002, local public health has been mandated and given resources by the federal government to respond to emergencies. And so we have an emergency response division, emergency preparedness and response division here within our department as well, currently overseen by Paulette Valentine and some good staff that you might have met. My topic today is going to be to give you an update on COVID-19, which is the name for the new coronavirus. This is a situation that changes almost hourly, and so in phone briefings that I was on yesterday with the Utah Department of Health, we're actually separate from the state health department. We're a separate local entity, and also through the CDC, policies and numbers are changing. You'll see a report the next day. If you go to the same website with the World Health Organization, it'll have different numbers, and that's pretty normal for a situation like this that's getting lots of attention and concerns people because ultimately it impacts your health and you wonder about your safety, and sometimes even people worry about a life or death situation. So hopefully this will give you a really good summary of what COVID-19 is, how you can protect yourself, what the threat level is, and then again, I'm open to any question you might have. Dr. Blodgett right now is on the local radio station, KDXU, answering some questions, most of them pretty good, some of them a little out there, but he's able to do that quite well. So one of the things we want to do is be a reliable source of information, to be able to answer questions and to quell panic or misperception. To begin with, COVID-19 stands for coronavirus disease 19 because it was first emerged last year in 2019. It was first detected in Wuhan, China. That's a large city in the Hubei province in December. And at first it was just a few extra cases of pneumonia. The hallmark deadly symptom of this respiratory disease is it gets low in the lungs and causes pneumonia and has caused death for some people. It was out of the ordinary. China, unlike previous situations, including SARS, if you remember that outbreak, where they were less than transparent, China has been a lot more open to work with international health responders in this. And so within a few weeks, they determined this was a new disease that we hadn't seen before, a new form of coronavirus. Coronaviruses are actually a large family of viruses that some of them can cause respiratory disease in humans. Everything from the common cold, so most of you in here have had a coronavirus before, all the way up to more serious diseases like SARS, which is the severe acute respiratory syndrome that you remember came out of China years ago and then went away, and MERS, which is the Middle East respiratory virus that still pops up sometimes. And so this is brand new. At first they called it SARS-2, but that's a little bit confusing and it made China feel bad. And so the World Health Organization a couple of weeks ago named this COVID-19. So when I mentioned COVID-19, that's the new coronavirus we're talking about. It's about 80% genetically similar to SARS, and so that's why they called it SARS-2. As far as the current risk, the current status report of where the disease is at, as of this morning, according to the World Health Organization, there are over 90,000 confirmed cases internationally. Now, the majority of those, over 80,000, are in China, concentrated around that province where Wuhan is located. The remaining 10,000 are distributed throughout 72 countries, and that number rises every day as more and more countries see small pockets or outbreaks of COVID-19. There are, so far, I think, a little over 3,000 deaths that have been confirmed from people who've been infected. Most of those, again, are in China. There have been about 165 in other countries. As of last night, there have been 9 deaths from COVID-19 in the United States, and those are based on some cases up in the northwestern states, I think Washington and Oregon, and mainly in an outbreak that was in a nursing home there. There are, I'm trying to know the current number. I think it's increased in the last day or so. I think there are 14 or 15 states that now are reporting coronavirus cases in the United States. Utah is not one of them. We don't have any cases that have been diagnosed in Utah. There are none in southwestern Utah. Now, does that mean that coronavirus isn't here? You know, it's possible that it could actually be circulating. Part of that is good news because most of the people that have had COVID-19 so far have recovered fully. That's one thing to remember as people start panicking, and the media sometimes doesn't do the best job of calming people and giving accurate, balanced information. It makes a good story if you can talk about the sky is falling and the world is ending. We've weathered many outbreaks before, whether it was the 2009 H1N1 flu pandemic or other outbreaks we've had like SARS in the past. And so one of our main messages, this is no time to panic. The current risk of anyone in this room getting coronavirus is very low. And if and when it does reach our community and circulate, most people will still not get COVID-19. And most of those that do, it will be a mild disease and they'll recover just fine at home. This is just another illness that nature has produced that may go away like SARS did. So if you remember when SARS came out, when spring came around in April, SARS disappeared and we haven't seen it reemerge. We hope that will be the same with COVID-19. That's a possibility. Right now you don't hear that prospect talked about in the media. They're more talking about how this is going to get bad and kill all of us. So just keep that in mind, that we really want to discourage panic, and those of you who are hearing this presentation can also educate and share this information with other people. We also want to point out that one of our main ways of helping is to provide reliable information. And right now, the base of our information we provide from the health department is swuhealth.org. That's our website of your local public health department, swuhealth.org. If you go on that page, you'll see the coronavirus story. You just click on it. If we do have positive cases here in southwestern Utah in any of our 5 counties, or if there's any new information, we'll post it there immediately. And these days, the way information goes around, a lot of times you as the public or partner agencies can get it at the same time as the media does, the news media. So that's probably the best resource. We also link to the other sources that are going to have the most accurate information. That would be the World Health Organization and the Utah Department of Health, places that will give updates and good solid information on this new disease. So as a respiratory disease, a lot of people wonder what is it? It's pretty much like a bad cold. The typical symptoms of COVID-19 include coughing, fever, shortness of breath, and again, the complications have been that in some people it gets down deep in the lungs and can cause severe pneumonia. Right now, as they've done studies over the people that have passed away in China, the fatalities there, they've determined that very young people, children, and people over 80 are not really at high risk if they get the disease of being a fatality. And so the very young and very old are actually being spared in this situation. That big, large group in between ages 29 up to 79, which includes, I think, most people, that's kind of where the fatalities have been spread. And as far as treatment, people wonder, well, what do I do about it? There is not a vaccine. There are a couple of companies that are actually working on a vaccine. Conservatively, it takes a year or two sometimes to come up with a vaccine. If people really get ambitious and get enough funding and resources, sometimes we can do one within a few months. That's what happened in 2009. Right after we distributed the seasonal vaccine that year, the swine flu had come up, and within a few months we had a new vaccine for the H1N1 flu that year. And so we had another, down around here we do the flu shootouts where we do the mass vaccination exercises, and we're able to distribute that brand new vaccine within a couple of months of the H1N1 flu coming out. So a vaccine is on the horizon for COVID-19, but again, if it disappears in a couple of months, it will not be needed. That's the optimistic, that's our hope. That's kind of what we're hoping for. But when you're dealing with something, like a virus, we really can't predict what will happen. We can just kind of plan for the best and the worst. With the current risk, I want to mention again that even though the World Health Organization declared this a global emergency on January 30th of this year, it is still considered low risk in the United States as far as the average person contracting the virus. There are 3 criteria for something to become a pandemic. One of those is the disease has to cause illness and death. The second is it has to have sustainable person-to-person transmission. And the third is it has to spread globally. So far COVID-19 has met two of those criteria with the illness and death, spreading person to person. It's in 72 countries, but it's not quite global enough to be considered a pandemic. So I wouldn't be surprised if within the next month this was declared officially a pandemic by the World Health Organization. Again, that's not cause for alarm, it just defines the disease and can help get the necessary resources behind it. And again, the last pandemic we experienced was when? 2009 with the H1N1 swine flu pandemic. And that actually spread much quicker than the current COVID-19. By the time we were getting ready to have a press conference and alert the public, we already had cases in our district with the H1N1 flu. So that's another good thing about COVID-19, it doesn't spread as fast as the flu. Now some people have wondered about the fatality rate. We actually will not know the fatality rate or death rate until this is long over and we get the final data put together. With SARS, the death rate ended up being about 10% mortality rate. Of those who were sick, 10% died, and that's a very high mortality rate. As of this morning, the World Health Organization made a statement that it looks like that COVID-19 has a 3.5% mortality rate. The problem is, it's the iceberg effect. The tip of the iceberg is, those are your confirmed cases that you lab test. Most people that die are going to be in a hospital and recorded. But under the surface of the ocean, you have the big bottom part of the iceberg. There are probably thousands and thousands of people who were infected and don't know it, or have a mild disease, and it's just like another cold, that have never been counted. So in all reality, our director, Dr. Blodgett, has stated it's his opinion by the time this is said and done, the COVID-19 death rate could likely be under 1%, or around where the flu is. And so, again, the media will try to usually stick with the higher numbers, the more alarming numbers. I don't want to bash the media because we have a lot of local media partners that help us get the word out. But sometimes the national media, or those who are kind of competing for viewers or clicks, are going to say things that are a little bit more alarming to make you click on their story. And to me, that's not helpful. Another thing that's not helpful is how politicized this can go. So if you're looking at a source about COVID-19 and its purpose seems to cause fear, or if its purpose is to use it as a political hammer against either party or whatever it is, or if they're trying to sell you something, that's probably not a good source for COVID-19. So a lot of people, you've heard the phrase before, never let a good crisis go to waste. There are less scrupulous people that are using this event to further agendas or make a little money or scare people. And so human nature can become victim to that, but my belief is also that human nature can also rise above that and look for accurate information and work together as a community to try to lower panic, especially any of you that have kids right now. So it's fun for us as adults to scare each other and tell wild stories, but there are little kids hearing things at school and seeing things on the media that need real adults that are mature and not afraid to give them accurate information and calm them down. That's what I've done with my kids. Every day they come home, Dad, guess what I heard about, coronavirus or COVID-19, and I'm able to give them accurate information to say, here's what it is, here's our current risk level. Even if it did come to our community, it really is quite possible that, and in fact, it would be surprising if we didn't see some positive cases by the time it's all said and done. We have dealt with things like this before. On a seasonal basis, you probably heard this comparison, starting in September, peaking in February, and petering off in the spring, we have our annual flu season. Every year we lose a few of our community members to the flu. The United States loses conservatively between 20,000 and up to 80,000 people die every year from influenza. It's the one contagious disease that's still on the top 10 killers of citizens in the United States. And we seem to do okay every year with the flu, right? Nobody freaks out every September. Maybe some of you do, I don't know. And so I don't want to downplay the effects of contagious illness, because that's one of our missions as public health, is to try to prevent it and then mitigate it if it does come into our community. But I do want to share this as part of getting perspective, what our response should be and how we can work together as a community. This isn't a time to panic buy and batten down the hatches. There's a lot of people right now that over the last couple weeks have gotten their 2-year supply of toilet paper and water and masks. When this is over, they're going to have 2 years of toilet paper, water, and masks, and maybe that's better than nothing, but there isn't a need for that, and it's pinching a few people. I've heard that some clinics or dental clinics that send their clerks out to get these N95 masks occasionally can't find them anymore. If you go online, they're hard to find, and some people are fleecing people by selling those. You usually buy a box of 20 for $20 at Home Depot. They're going for like up to $200 now on eBay. And so again, never let a good opportunity go to waste. I see some of you having ideas, don't go that way. And to answer the question too, and maybe to dispel some myths, what do we do about coronavirus? If it wasn't our community, how could we prevent from getting it? So again, COVID-19 is a coronavirus like the common cold. Also, influenza is a respiratory virus. It's all the same in the way that we treat these, even the way that we respond if they become an emergency or how we prevent it in the community. And it is, number one, it's not airborne. Okay, can anyone name any airborne diseases that you know of? There's measles, there's tuberculosis. There are a few airborne diseases where if Seuss here had the measles, walked through the room and coughed and walked out again, we'd probably all get it. That's what airborne diseases are like. Influenza and coronaviruses and COVID-19 are droplet-borne, meaning it doesn't stay around in the air when a person is talking, laughing, sneezing, coughing, and expelling the particles of virus into droplets of the saliva. That has about a 3 to 6 foot range, depending on how robust you are, and then they drop to the floor. They don't remain suspended in the air. And that is why wearing a mask around is useless with the respiratory disease. The only use for a mask is if you are the sick person and you don't want to get other people sick, or if you are doing direct care in a clinic setting, or let's say even if you're home and a family member is sick within that 3 to 6 foot range, you put on a mask and it's very temporary. Who here has worn an N95 mask before for any purpose? How fun are they to wear? Okay, after about 15 to 30 minutes, they get saturated, they're very uncomfortable, they feel claustrophobic, it's actually harder to breathe. And so those are meant to be a temporary safety barrier. And so again, people that are buying up these masks and wearing them out 24/7, it's kind of like a Dumbo's feather. It may provide some security, but in reality, it's quite useless. So again, a mask is only useful if you are the sick person to protect other people, or you're doing temporary direct patient care. At that point, you take the mask off and you throw it away. And if you want to try one on, you'll have to wait till they come back to Home Depot. So that's some of the myths about the masks that sometimes people get a little bit too hung up on. As far as what is being done, so some people have the question, well, it's coming. We're seeing more and more cases in the United States. What is happening as far as public health efforts? So on a national level, if you are a foreign national and you have been in any of the high-risk countries within the last 2 weeks, you are not allowed to enter the United States. If you are a United States citizen, you may enter the United States if you've been in one of those high-risk countries in the past 2 weeks in one of 11 designated airports. As soon as you arrive, you will be screened by public health officials and possibly go into a quarantine situation. Now, quarantine is when you are healthy, but you've been exposed and you need to be quarantined or isolated for a period of time until it's determined you're no longer at risk. Isolation in itself is when you're sick and you are isolated from other people until you're recovered and aren't at risk anymore. And so there are a few military bases as people are flying in that they have designated where people are gone and cared for and fed until that window is passed. If a person has been infected and they're recovering, they test them for coronavirus. As soon as they've had 2 negative tests in a row, then they're considered low risk and they can return back to their community. Again, we have had no cases diagnosed yet in Utah. We probably will, but we haven't yet. We say this just because it's been publicized. We don't reveal any personal information as a public health department. There have been people, because they publicized it from the state on the cruise ships, who are in the process of returning, and again, that's between them and outside of our public health system. But once they come back here, it's understood that they are no risk to the community. So the next question is, in Washington State, they did some testing and found that it may be possible that COVID-19 has been circulating in their community for 4 to 6 weeks. And so coronavirus could have also been circulating around before we started our public health efforts. That's actually not bad news necessarily, because that would mean that it's circulating, but people have mild enough diseases where they either don't have symptoms or they're not sick enough to go into the doctor. And so that's not necessarily bad news that COVID-19 could have snuck in under the radar and is already circulating in communities. The way that viruses go, again, it would be weird if it didn't show up here and circulate through, but best case scenario, in a couple of months with the weather changing, we'll see this virus fade off and go into history like SARS did. Worst case scenario, it continues to spread or possibly become worse, but even if that happens, there are things in place that we ask people just to be prepared for. And that is what they're already doing in some other countries, and that is closing down churches, schools, mass gatherings, having people be more isolated in that way until the disease passes. And so this is an opportunity, even though that may not happen in our community. Preparedness doesn't begin with government, with the health department or the state or federal government. Preparedness really starts individually. All of you are first responders at home, with you as an individual or with your families. And so regardless of where this outbreak goes, it's a great opportunity to encourage everyone to look at what are your family, your business, your organization's preparedness plans if some of those things were to happen. So if mass gatherings were shut, if schools were shut, how would your family handle that? Do you have a plan B in place as far as what your kids would do? A lot of parents may be panicking because, how do we keep those guys entertained for that long? So what would you do if your church no longer met publicly for a period of time? I think in Japan right now, they're encouraging families to homeschool for a couple of months. I know the Church of Jesus Christ of Latter-day Saints in those areas, they've closed down some missions, temples, and they're encouraging members to have services and sacrament at home. And those are higher risk countries, by the way, like in South Korea and Japan and some of those areas. But it's not a bad question to ask, what if this happened in our community, what would I do? And to brush up on those plans. And again, the panic buying is not encouraged, but it's also an opportunity to take a look at your pantry and say, if the store shut down or if travel was prohibited for a couple of weeks, how would I eat for the next couple of weeks? Some people would think I'd be pretty good, and others of you might want to start panic buying. Just kidding, don't panic buy. So those are some of the things as far as preparation and response. Again, there is no vaccine for this illness. For most people, it's mild and they recover. If it does get bad and they go, then they receive the same supportive care and treatment that you would with pneumonia or a severe cold or something along those lines.